everybody. Welcome to Pick Dr. Osborne's Brain. If you're new to the show, we're going to take your nutrition questions. So if you've got challenging questions you'd like to ask me and get those answered today, type those into your chat box or feed. Now I'll do my best to answer as many questions as I can in the next hour. If you're new to the show, welcome. We're here every Thursday at 12:30 Central Standard Time to take your toughest nutritional questions, autoimmune questions, gluten-related questions. And if you'd like to get free information from our channel, go over and visit me at glutenfreesociety.org. You can sign up there for our newsletter, and we'll send you a tremendous amount of free information on how to navigate diet, lifestyle changes, and autoimmune disease. So welcome to the show. Let's dive into your questions. Let's see here. Jessica's asking, Dr. O, what is your thought on the heel ray for gum healthy? My teeth are so sensitive to cold and hot after my teeth cleaning. I'm not familiar with the heel ray. I might have to ask my son, who's a dentist, about that particular system, but it's not something I'm familiar with. But what I can tell you, Jessica, is if you have a strong proclivity toward cold and heat sensitivity with your teeth, you want to get a toothpaste that has hydroxyapatite in it. Hydroxyapatite is the mineral complex that can bind to the enamel in your teeth. And for many people, that helps to dramatically reduce sensitivity to both cold and heat. So check that out and see if that's helpful for you. Can we scroll up on the YouTube feed?
This way.
Yep, all the way to the top. Here we go. Interesting to me that as been off grains and wheat, I tried gluten-free pasta, but bought conventional ricotta that has modified cornstarch, but free-range beef for warm and mushy. Mega sinus, I guess you mean mega sinus problems, self-inflicted. Yeah, I mean, if that's what you mean, a lot of folks, I see it all the time. It's why I wrote No Grain, No Pain, the book. So many people would go gluten-free in the traditional sense, the wheat, the barley, the rye free. And then they would go over to the grocery store and they'd navigate all the garbage junk food, labeled gluten-free, the stuff with corn and rice and even oats. And they would find themselves in a quandary, right? We actually have a name for it. It's called gluten-free whiplash, where you think you're going gluten-free, you feel better initially, and then you start incorporating all that junk food that is labeled gluten-free into your diet, and bam, you start whiplashing backward into symptoms. What do you think about marijuana? I'm not a fan. I mean, I'm not a fan of any kind of medication or drug, especially one that alters consciousness to the detriment of the user. And what I mean by that is not to say that there can't be medicinal benefits from marijuana or THC. Certainly, I've had patients historically that have found tremendous use for it. But as a long-term solution for anything, I don't like it. And as a habitual thing that people do, very clearly it damages and degrades brain function and brain cells. If you go back in time, there's a reason why we call it dope, because it makes people lose brain activity and brain cells. And some of the newer stuff today, some people would argue, well, just like it's the food with the genetic manipulation and the glyphosate and all that. Marijuana is now being, tailored, created, genetically modified. Some of these strains that they're selling now legally are much, much more powerful and much more psychoactive. And so there's the potential for that as well. I've got several friends that are ER doctors who have told me their experiences with these newer strains of marijuana as they see record-breaking ER trips for people smoking or eating, using edibles, marijuana edibles, for psychoactive major stress events. And so it's just not something that I would encourage people to do if you're seeking real health. What could be a trigger for burping and chest pressure when exercising? My husband has a hiatal hernia, also high blood pressure, and had a procedure with 2 stents a year ago related. Yeah, it could be. If you're talking, Christine, if you're talking about your husband, when he tries to exercise, he gets burping and chest pressure. If he's had stents, I mean, he may have some additional vascular issues, and that extra pressure from the exercise is creating the symptomatic blood flow issue as the muscles demand more blood if the cardiovascular system, if he had stents, it's probably because he had atherosclerotic plaquing of his arteries, of his heart arteries. And so there may be other areas where that's also the case. And so he's having some of those symptoms as a consequence. I'm not sure if that's what you meant or not, but as far as what to do, you might have him taper or tailor his exercise back a little bit, at least initially. And then you might also have him look into, if it is a vascular issue, I mean, I would be on high dose vitamin C and high dose lysine. You should watch my crash course on lysine, to get some more details about that combination of nutrients for helping support blood vessel and blood flow. He might consider arginine or citrulline, the amino acids, to vasodilate when he's exercising. Take those supplements before exercising. They can vasodilate, so open up the arteries, allow for better blood flow and oxygen flow, which might help kind of alleviate those symptoms. But those are just a couple of strategies that I would look into. Beyond that, if it's something more serious, I'd highly recommend that you get him in to see a good functional practitioner, functional doctor, who understands how to do a better workup and just really help him more specifically. For family members being exposed to some wildfire smoke, what do you recommend to clear the particles from the nose and lungs? From the lungs, I recommend NAC, N-acetylcysteine, at about 2,000 milligrams a day, post-exposure and even during exposure. Outside of that, they need to have good air filters inside. If they don't already, a good ultrafine HEPA air purifying device is going to help to improve and scrub their air, because you can't control those fires. As far as clearing particles from the nose, get a good hook nose bottle or a neti pot, and use that a couple of times a day until the smoke and the debris subside. But those are strategies that'll help kind of keep them cleared out. Are hydroxyapatite supplements good for bone loss? Yeah, they can be, but remember, bone loss happens for more than just the loss of the minerals found in hydroxyapatite. Most hydroxyapatite supplements are predominantly calcium hydroxyapatite, which is good. You need calcium for bones. But there's a lot more minerals and there's other nutrients that play a role in bone health. So I would encourage you, if you haven't already watched my bone class, go back and watch that class, because I go through kind of the physiology of bones and what you need to understand as far as nutritionally what bones need. Because you need calcium, you need magnesium, you need zinc, you need copper, you need lysine, you need proline, you need other amino acids, you need vitamin C. Like, there's a tremendous amount of different nutrients necessary for bone health. And I've seen people like pump the calcium hydroxyapatite. It has zero effect on their bone. And then when we actually analyze nutritionally what they're low in, we start moving the needle in the right direction. Let's see here. Since January, strength training twice a week. Good for you, Tammy. Seem to have a pinched nerve. In my search and dealing with nerve pain, notice that being celiac, which I am, can cause pinched nerves. Why would this be? It's not so much that celiac causes a pinched nerve after you go gluten-free. Let me explain. You can have celiac disease. One of the manifestations of gluten can be nerve damage. And so it can cause neurological inflammation. And so symptomatically, that can translate into what feels like a pinched nerve or a neuropathy. So that would be what we would call a chemical induction, or a chemically induced neurological inflammatory damage. Now, if you've been exercising now and you didn't have the pinched nerve sensations before the exercise, then probably what's happening is it's not the celiac disease. It's probably something in your exercise that you're doing. Maybe as you're building new muscle, you've created patterns of tightness. Depending on where the pinched nerve sensations are, for most people, pinched nerve sensations are either coming from the neck, kind of upper mid back, or from the low back, where you get like a sciatica, radicular nerve pinch going down the back of the leg. That context would help me give you a better answer. But I would argue that if your pinched nerve sensations started after exercise but weren't present before, it's probably a physical pinched nerve. Probably the best doctor you could go see would be a good chiropractor. That's their expertise. That's their bread and butter. And a lot of times it's just a physical structural issue within the spinal column itself, or the muscles which you've been strengthening you've created some kind of type of pattern where there's a tightness or a pinch, and that can lead to those symptoms as well. So maybe if you give me a little more context, I can give you a better answer. I have been diagnosed with uterine fibroids and cysts on my left ovary. My OB suggests surgery, which I don't want to do. Yeah, I don't blame you. So if you got cysts on your ovary and then they've diagnosed you with PCOS and you've got uterine fibroids, you probably have estrogen dominance, and you probably are gluten sensitive, and you're definitely you've got a blood sugar problem, because cysts on the ovaries manifest as a result. It's a form of diabetes of the ovaries. A lot of people don't realize that, but PCOS is caused predominantly by blood sugar fluctuation problems. So you got to dial your diet in. The first thing I would do, because you can always have the surgery down the road if you absolutely need it, and if there's no emergent or urgent medical need to have it right away, change your diet first. Go get a copy of No Grain, No Pain, follow the phase 1, and then go to the phase 2 diet in that book, and do that for at least 30 days. You may need to do it longer, but what we're looking for are some types of improvements in that first 30 days. If you're feeling dramatically better, then you're on your road in the right direction. Consider getting micronutrient tested. A lot of times fibroids and cysts occur because of iodine deficiency. I've seen them be as a result of chromium and vanadium deficiencies and B vitamin deficiencies. So having those things looked at and then supplementing accordingly might also give you tremendous benefit. I'll post a link for micronutrient testing, because most doctors have no training in nutrition. You go ask them to do some testing for you along the lines of vitamins and minerals. They look at you like you got 12 horns coming out of your head. But we offer at Gluten Free Society, we offer that type of testing without needing a doctor, and that might help you. So we'll post a link for you. Any advice for someone with Parkinson's or thyroid nodules? Lots of advice. With Parkinson's, you got to change your diet. It's an autoimmune condition. It's a neurodegenerative condition, and diet change has to be the top of your priority. A lot of people that have Parkinson's are gluten sensitive, and so we see quite a bit of improvement when people change their diet, depending on how late stage the Parkinson's is. If it's earlier stage, if it's kind of nuanced early on in, and you're starting to notice some of the tremors early, diet change early can be very effective. Now, if you're 20, 25 years into a Parkinson's diagnosis, it's just my experience that diet change doesn't reverse that. It's not going to reverse that. You might get benefit from the diet change. It's just not going to stop fully the problem. Also with Parkinson's, we see a lot of folks that have mold. They're living in mold. And so those mold toxins are also neurotoxins that can damage the nervous system and contribute to Parkinsonian-like symptoms. So I would be looking at those two things. As far as thyroid nodules are concerned, you got to look at nutrition first. I have a whole crash course on nutrition in the thyroid. Maybe we can post a link up for Jeanette on that. Watch that crash course. It's super thorough. You're going to learn all about how vitamins and minerals and the deficiencies of certain ones can actually cause thyroid nodules to occur. I mean, we've seen people whose doctors or endocrinologists were saying, go have surgery. We need to remove your thyroid. They changed their diet, add some nutritional supplementation. Bam. Within a few months, the nodules are shrinking and going away. They didn't need surgery. They just needed common sense nutritional guidance. So look at that crash course, because it's a huge question. There's a lot of context there. Is there a remedy for acute hypertension triggered by acute COVID-19? What do you mean? So, I mean, acute COVID-19 goes away within a couple of weeks. So that's your remedy, is it's letting it run its course and recovering. And if you're not aware, Melinda, we have an immune system protocol that we recommend that people with COVID and any other type of viral infection use. So I'd encourage you, if you haven't already, to check out our immune protocol. We can post a link up for you as well. Because that's the solution. The hypertension, if it's, a lot of people will get, their blood pressure will go up when they have an infection because there's an inflammatory cytokine storm that drives it. But once you get that under control, again, the hypertension should resolve as the cold resolves as well. Are there exercises to help a genetic myopia condition in an 11-year-old child. I know there are plenty of eye exercises that can be done. I personally don't have a lot of clinical experience giving people eye exercises for the reversal of myopic conditions or vision problems. It's just not my forte. But I know they exist, and I know I've had patients historically who have seen good ophthalmologists that taught them those things and made some good recovery. So you might want to do a little bit more research on that. But as far as specific exercises, I'm not the right person to ask. Sorry, couldn't be more help. How much protein do you need, or what's a good protein for people with stage 3 kidney disease? That's a monster of a question because there's a lot to unpack. But uh, so how much protein a person needs is dependent on what a person is trying to accomplish. But if we're talking about baseline needs, Jacqueline, how much protein does a person need? Don't follow, in my opinion, don't follow the general RDA guidelines on protein. Those guidelines basically have created massive wide-scale protein malnourishment in this country. Most people need between 0.8 and really 1.6 grams of protein per kilogram of body weight. So just take your weight in kilograms, and it's going to be somewhere between 0.8 and 1.6. Now, I know that's a larger range, but again, that's where the context of what are you doing? Are you trying to exercise more and you need more protein for recovery? Are you immunocompromised and you need more protein to build antibodies to support immune system function? With kidney disease, if you're in stage 3 kidney disease, a lot of doctors are going to warn you away from protein. They'll tell you protein's hard on the kidneys. Protein's not hard on the kidneys. When the kidneys are damaged, you will spill protein into the urine, and doctors use that as a tracker for kidney failure, but it's kind of a guilt by association. Their claim is that you're spilling protein in the urine because you're eating protein, and you're putting pressure on the kidneys. But in reality, is your kidneys are damaged and they don't retain nitrogen and protein as well. So it's not the protein that causes the kidney damage. It's actually the carbohydrates, the high carbohydrate diets. Number one of the top complications for diabetes, which is high blood sugar, is what? It's kidney failure. You're actually, I think it's last research paper I read on this was like 32 times more likely to need dialysis with diabetes, with blood sugar problems, compared to, so 32 times more likely to need dialysis versus 16 times more likely to have a heart attack. So kidneys definitely get damaged by excessive carbohydrate. The problem with today's nephrology guidance on this is they're telling you eat carbohydrate, not eat protein, and you're never going to escape chronic kidney failure as long as you're on a high carbohydrate diet. But they're all scaring people away from protein because they're saying that protein causes kidney disease. I tend to say, depending on the situation, I mean, without knowing more about you, it's hard really to answer so specifically as I would if you were here in my office and I were seeing you. But the reality is, it's a unique question. We have to take into context what you're doing, but no less than 0.8 grams of protein per kilogram of body weight, as much as 1.6 grams, maybe even more, depending on you. And, I would run tests and other things to look more specifically at what your protein needs might be and why are your kidneys under duress? A lot of people develop kidney failure, kidney disease, aside from carbohydrates. One of the top reasons we see that happen is gluten-related kidney damage. And I have a whole piece on that if you want to read more about how gluten can impact the kidneys in a negative way. And you might want to get that looked at, because for some people, they don't develop celiac disease. They don't have gut symptoms. For some people, the only manifestation of gluten exposure is kidney damage. There's actually a situation, an autoimmune situation called IgA nephropathy, which we know gluten can cause. Ehlers-Danlos syndrome with an S-curved spine, doing PT home exercises, back muscles and spasm to protect the ribs, which makes the ribs subluxate. You got to get tested. I mean, your question is any supplements that can help, but I mean, when you're talking about a complex disease like Ehlers-Danlos, there's probably a gluten component. There's most likely a vitamin B12 component. B12 is necessary to get oxygen into those muscles, and so if you're dealing with muscle spasms, one of the things that exacerbates that is not having adequate oxygen delivery through B12 induced anemia. And there's definitely research linking that with complications of Ehlers-Danlos and POTS and other dysautonomic disorders. But you've got to figure out the driving force behind the autoimmune complexity of the dysautonomia, which is what Ehlers-Danlos is. And so, what are those things? What are those triggers? Food, chemicals, microbes, nutritional deficiencies are the four categorical triggers that will continue to exacerbate that particular condition. So I'd strongly encourage you to do some specific testing with that individual to make sure that you get kind of customized guidance through it. Because I mean, we could say, okay, yeah, we can reduce muscle spasms with things like chamomile and valerian. We can use higher doses of magnesium as well. I mean, there's plenty of things that have a therapeutic benefit, but you don't want long-term therapeutic benefit as much as you want a long-term solution. At least that's what I would think that you would want. Polycystic ovarian disease has been reversed. What causes a prolonged scanty period? You might have, Suman, you might have an iron deficiency that's lingering. A lot of people with PCOS, I assume you mean PCOS or polycystic ovarian disease, as opposed to PCOD as opposed to PCOS. But if your periods are scanty and they're not consistent and they're light, the very common side effect or a very common trigger for that is anemia. So, with blood loss, and especially a chronic anemia where somebody's diet historically has reduced their capacity to absorb iron. And so they're left with iron deficiency that is what we call refractory, meaning it's not correcting even though the diet's changed. And those individuals need to be tested and they need to be supplemented accordingly. I make IgG, IgE, and histamine test. Am not sensitive for legumes and nightshades and coffee. Can I use it? I use also pea hydrolyzed protein. Is that okay? Depends. If you're not reactive to pea, then, if you're using that as a protein source, it could be okay. It's as a general rule of thumb. As far as the legumes and the nightshades, if you're not showing up positive IgG or IgE, does it mean that you're not IgA reactive? And there's also something called a T cell response. There's also something called an immune or a direct immune response. And you've only been tested for two of several mechanisms of why a person, might have an immunological reaction to food. So what you've had testing, the testing you've had done is not comprehensive for me to be able to answer that question to say legumes, nightshades, and coffee are safe for you because you haven't had comprehensive food sensitivity testing. You've had limited food sensitivity testing. Sorry, I can't be more help, but on the flip side, if you don't have the availability to do that type of testing, what I would suggest you would do is take those things out, those three things, the legumes, the nightshades, and the coffee for 6 months, then bring them back in slowly one at a time and pay very close attention, maybe keep a diary on how it makes you feel. And if you tolerate them well, then I would worry less about it. But without the appropriate type of testing, the comprehensive nature of the appropriate type of testing, it's a lot harder to answer that question. And thank you so much for your donation to the channel. We really appreciate it. TikTok, let's see. Diagnosed with DVT, deep vein thrombosis, and pulmonary embolism. What are my options if I want to avoid blood thinners? Well, first of all, don't take this as medical advice. DVT and embolisms are very, very serious and life-threatening potentially. You need to talk to your cardiologist or whoever it is that is your treating doctor. But I can give you some things that we use on a regular basis to support healthy blood flow. And probably the top thing that I would look at using supplementally would be omega-3, concentrated omega-3, like high dose EPA DHA. These have a regulatory effect on blood viscosity. And so low levels of EPA actually can make your blood thicker and make your platelets more clumpy and make them stick together more readily. So if you have an omega-3 deficiency, that could be playing a role And so, anywhere from 2 to 8 grams a day is what I would generally use in a person who was seeing me, where we had testing to validate that need. Beyond that, I might consider higher doses of magnesium. Magnesium is a natural platelet inhibitor, so it inhibits platelet aggregation and regulates platelet aggregation. So magnesium, you definitely should get that tested, but you might consider using it supplementally. I would be looking at some of the proteolytic enzymes. They have an impact on clotting as well. And so there are a number of different varieties. We have a formula that I'm partial to. It's called Matrozyme that we use in situations where we're looking to optimize blood viscosity for people. But those are areas that I would definitely look at starting in those areas first. But again, get with your doctor. Hopefully you have a doctor that's versed in nutrition as well and is not just wanting to pump you full of Plavix or warfarin, because long-term, those drugs they've got some pretty complicated side effects. I just had a case last week, a woman on Plavix, and she was having severe pain, and severe fatigue, and her mental capacity just dove off a cliff after just a few days of being on Plavix. And when she approached her cardiologist about it, he laughed at her and said, "That's not a side effect." So what did she do? She went home and looked it up. There it was, plain as day on the manufacturer's website. Those were the side effects of that particular medication. And that's something else you guys, all of you, should be aware of. We see this happen a lot in the clinic, where doctors gaslight their patients and say, no, that's not a side effect, when the manufacturer of the drug very clearly lists it as a side effect. So always, this is where we go back to do your own research. It's not hard. Go to the drug company's website and look at their own published data. They have to list it. By law, they have to list the side effects in the research that allowed that drug to be FDA approved. So anyway, hopefully that helps you a little bit. Will vertigo caused by neck muscle stiffness, which exercise is better to reverse? I guess what you're asking is, which exercises can you do to reverse vertigo caused by neck muscle stiffness? There's a lot. I mean, it just depends on which neck muscles. You've got a lot of different neck muscles. You've got these front scaling muscles. You've got the paraspinals in the back. You've got some of the deep neck flexors as well. So it depends on which of those cervical muscles are tight and driving the vertigo. So getting an assessment would be step one, like which ones are tight, because with the neck, sometimes the front neck flexors are weak and the posterior neck extenders are overworking or overcompensating, and so you get kind of a pattern disrupt, and that can be diagnosed by somebody who knows what they're doing. But if you're talking about general stretches, there's plenty of just nice general stretches that you can do for the neck that might have an impact on vertigo. But again, there's nuance to that question. I would start with some simple stretches just around the neck in general. If you look at, we have some stretches, I think, on our YouTube channel on the neck and shoulder, and there's just general like the smelly armpit stretch, and then just straight down the frontal stretch where you're just pulling the neck down. And then there are different exercises that you can do, like chin tucks, that can strengthen these deep neck flexors that are oftentimes very weak in people who sit at desks for long periods of time. So all those could be potentially beneficial. I would encourage you to visit a chiropractor. Again, that particular type of doctor is probably one of the best at helping with muscular-induced proprioceptive vertigo, which is what it sounds like you most likely have. I have mast cell activation, and when I take high amounts of methylated B vitamins, I get a histamine reaction. I was told to take very low amounts of B vitamins. Would ultra nutrients be a good fit? Yes, it would be, because it's a lower quantity of B vitamins, Anna, in that particular multivitamin. If you've been told to take lower amounts, ultra nutrients is better than multi-nutrients for that very reason. And I would start, and if that's what you were told, I would also listen to your body. But start with, if you're going to use ultra nutrients, start with just 2 a day and see how well you tolerate that. And then if you do tolerate that okay, bump it to 3. And if you tolerate that okay, bump it to 4. 4 a day is kind of the recommended dose for that particular product. But Everybody's got different tolerance levels. So start low and work your way up. What are the health benefits of pineapple? Well, I mean, probably one of the biggest and most popular and famous benefits of pineapple consumption is the enzyme bromelain, which is a proteolytic enzyme. It has anti-inflammatory properties that can affect blood viscosity and can also affect pain. When you mix bromelain with cysteine and nettle, you get a mucolytic effect. You can actually help break up mucus if you've got mucus congestion in the lungs or the sinus cavities. It also can be helpful in stabilizing mast cells. So in the sense where mast cells release histamine, and histamine is what drives allergy symptoms, bromelain mixed with those other nutrients can reduce or stabilize the mast cell, leading to less of a histaminic response. But we use bromelain in our proteolytic enzymes. We use bromelain. We have a product called Ultra Sinus Support designed to break up mucus. We have another product called Hist Assist, which is designed to basically to stabilize mast cell membranes. Benefits of HRT for bone health. Which HRT? So hormone replacement therapy is a broad term. If you mean estrogen, do you mean testosterone? Do you mean progesterone? Or do you mean all three? But if we're talking about estrogen has bone promoting, bone mineralization help. So it can definitely help to improve and to maintain bone density in women. So that definitely is a potential benefit. A lot of women, with HRT are just miserable because of perimenopause or menopausal symptoms. And so, having trouble sleeping can be an issue, and HRT can sometimes help with that. But in addition, hot flashes would be a reason, a libido, motivation. Some women have, kind of a loss of drive, not just sexual drive, but just a loss of drive for luster of life. And so it can be helpful in that regard as well. So, I mean, those are all effects that it could have depending on the person. What are your thoughts on BPC 157 and its ability to help with chronic knee pain caused by inflammation? I think it can be helpful. Not so much the oral. A lot of the companies now are selling oral BPCs, or not just BPCs, not just BPC 157, but other types of peptides. I'm not impressed by oral supplementation with peptides. I'll just say that clinically, we just don't see tremendous outcomes. So I don't really typically use them. If I need somebody, or if I want to encourage somebody to do BPC 157, I encourage more location-specific injection, where the problem is. So getting with a good ortho, and somebody who does that type of treatment can be very helpful, and does work. Now, is it a long-term solution for a person's knee problem? Absolutely not. This is the mistake I see people make all the time. They think that the passive treatment of the injection is going to fix why their knee started hurting in the first place. Remember, there's a reason you have knee arthritis, and it's not because you have a BPC 157 deficiency. It's most likely sedentary behavior, weak muscles, muscle imbalances, or nutritional deficits that don't allow your body to heal and repair cartilage. So you've got to look at those things for the long-term solution. On the front end, just from the perspective of getting quality of life back and being able to walk around without pain, BPC 157 can be very effective. What causes itching ear after drinking liquids, especially at night? It's hard to say. I mean, what kinds of liquids? If it's any liquid at all, I mean, does water do it? I would need to know more context in that regard, because there's not like a pattern of liquid-induced ear itching that I am aware of. Is there a natural, inexpensive solution to dark spots? You mean skin dark spots for family members who don't want to pay thousands of dollars for lasers? Depends on the type of dark spot and what caused it. I've seen, and I've had anecdotes of people using castor oil, organic castor oil, to improve skin tone around spots like that. Sometimes even if the dark spots are actually fungal, in nature, and they can be. I've seen cases, because fungus can produce pigment, and sometimes when people go out in the sun and the area on their skin gets darker, it can be a fungal kind of a fungal growth on the skin leading to increased darkness. And so applying kind of a local topical antifungal for some people can be helpful as well. So just something to think about. What doses do you recommend for high-dose lysine and vitamin C? Vitamin C's got to be at least 5 grams a day in divided doses, and lysine needs to be upwards of 4 grams or more to start with on vascular support. A person with long COVID, so one more person with long COVID, 4 years since and developed leaky brain in the last fortnight where he cannot recall names of things or connect with what he is supposed to do for next tasks. Has been seen by urgent care, who confirm they have seen a lot of long COVID patients with this recently. What would you suggest for this? Get them out of mold. That's my experience with the long COVID cases where they've been to multiple doctors and they can't figure out why and they're not recovering. A lot of times it's mold exposure in the environment that's driving the COVID experience. And I've seen probably 100 cases of that where we've identified mold in long COVID. And when we get them out of the mold, they start healing, they start repairing again. Remember, when you get COVID, the immune system goes into kind of a tank. And then most people, when they get sick, where do they go? They go home and they stay in bed. And if there's mold at home, now instead of having kind of intermittent exposure to that mold because most people go off to work or go off somewhere else in the course of their day, you can when you're staying home, you're getting 24/7 exposure to that mold, and sometimes that just leads to a deterioration in the person's overall health, and then it gets misdiagnosed as long COVID. So I certainly would look at it from that perspective. Now, outside of that, I would just do testing. I would test appropriately, get micronutrient testing done, get food sensitivity testing done. There's evidence now that shows that COVID actually induces gluten sensitivity and celiac-like inflammation in the GI tract. And so what comes with that is malabsorption. That's where that leaky gut, leaky brain connection can start to set in. So I would look at diet very, very specifically, because sometimes a change in the diet is the right move to make for folks. They don't, maybe they were eating those foods before and can get away with it, but now that COVID has come in and done that damage, they've developed or acquired food reactions that now need to be addressed. It's very common. Let's see here. Patient have lost muscle, fat, and protein by diarrhea because of celiac and leaky gut. So how I am gaining muscle with these diseases? Well, one, you got to change your diet if you haven't already. Go no grain, no pain. Step one. Step two, get nutritionally tested and see what you're lacking. Because if you're trying to regain the lost muscle, if you're trying to put mass back on your body, right, that requires calories and nutrients. The workhorses, if you will, the molecular workhorses of the body. It's how we heal, it's how we repair, it's how we rebuild. And the vast majority of people, as I would argue to say, all people with celiac disease as part of a historical context to illness are malnourished. I've never seen a case in almost a quarter century of practice where a person with a history of celiac disease had great nutrition. And so you have to understand those individuals are lacking so that you can target specifically what they need. And so they need to eat enough calories. They need to get the right nutrients in so that they can heal and repair the historical damage that gluten was causing them. And so that's the key. Now, if the cortisol remains high, there could be something else driving inflammation, because cortisol goes up when we're inflamed. So in some cases where a person is celiac, they also have other food sensitivities. And so if you're just going gluten-free but not identifying other food sensitivities, and you're eating those foods, your cortisol levels are going to stay up. Remember that cortisol is catabolic. It tears down muscle tissue. It breaks it down. So when your cortisol is high, it's pretty much impossible to put on muscle mass. So you have to determine what's driving the cortisol elevation. For most people, it's stress, lack of sleep, lack of nutrition, eating the wrong foods. Sometimes it can be infection or microbial imbalance. Sometimes it can be exposure to environmental toxins on a consistent basis. So those things all have to be ruled out. Once they are, that cortisol that's high is going to naturally start to drop, and that's going to shift the metabolism of the human, of the person, and it's going to allow them to engage into repair, rebuilding, and regrowing. But as long as cortisol is high, it's not going to happen. I get behind in the live shows due to life interruptions. Understandable, we all have that. Would it be possible to say what the posted link is for? I get further behind when I click on the wrong link. I don't know what you mean, Lita. Did you take, okay, Mel took care of you. Good. Okay. My son's mitochondrial, my son's mitochondria has been injured. What can I do to heal it? Good question, Diane. You have to figure out what injured it. What injured it? And how, let me ask you just another question. A lot of people say that. I hear that a lot. But I don't ever see any evidence of mitochondrial injury, meaning is there an objective evidence of mitochondrial injury, or is this something that you read about or something that another doctor might be speculating about? I'm not a fan of speculation where we can have objective guidance, where we have good testing and good data that can drive decisions, especially for somebody who's sick. And again, I'm not trying to pick on you. I'm just trying to get clarity. So if indeed his mitochondria are injured, you have to figure out what injured them. And there are a lot of things that are mitochondrial poisons, environmental poisons, toxins, chemicals. But going back to what are the 4 primary drivers of inflammation? The wrong food, chemical exposures, nutritional deficits, and then 4th would be microbial imbalance. So in the case of microbes, it could be bacteria, it could be fungal, etc. And so you would want to go through the process of identifying what for your son are the triggers for him and his mitochondrial damage. There certainly are nutrients that can that can support mitochondrial function. Things like CoQ10 become very important. B vitamins become very important in the context of mitochondrial function. But at the end of the day, if you don't know what damages mitochondria, you're not going to heal it. So the context is what caused the damage. And if you understand that, if you get those types of testing done for your son, you'll go a long way to helping him. What's your go-to back exercise, upper back and lats? 100% pull-ups all day long. There's so many great ways to do pull-ups. If you want to build a strong back, wide grip pull-up variation would build. If you're trying to build a V-shaped back and you want great lats, wide grip all the way. If you're trying to build more of your upper back between your shoulder blades and your shoulder blade muscles, then you can do kind of inverted grip, wide grip, or you could do for lats, you could do just a regular wide grip. So you just basically your palms facing the bar, go wide. If you want to build deep muscles in the center of the back, then you go invert, or you turn your grip in and go wide. If you want to build arms, you can come and you can just come in and you can do the kind of the classic chin up, where if you could turn your arms in this direction, you can also flip them around, palms facing the face, to build bicep muscles as well. But any variation on the pull-up is, and then as you get good, if you can't do a pull-up, so those of you who maybe can't do a pull-up and are thinking about the same question, consider a pull-up bar with bands. And there are a number of different companies that sell the big stretchy rubber band devices that you can attach to a pull-up bar and put your foot in like a stirrup. And what that band does is it takes tremendous amount of your body weight off of you, and it helps you. It's like a pull-up assist. But to me, that if you're talking about core calisthenic activities that I believe every person should be able to kind of comprehensively do on their own, pull-up is in the list of some of the most important movements you could do. But most people can't pull their body weight. It's 60% of the population is overweight and under muscled, and so using bands as a means to add support to kind of graduating into the pull up unassisted is a good way to think about beginning it. Another thing you could do would be to use the same bands, but to just pull towards you. And you can wrap those bands around the doorknob and close the door, and you can use them in that way where it's just an easier exercise to gravitate in toward. It's not quite as advanced of a movement for pull-ups for those of you who may not be able to do it. But pull-ups, push-ups, sit-ups, lunges, and air squats are really 5 calisthenics that every one of you should be able to do with your own body weight. And if you can't, that should be an alarm to you that you have a serious conditioning problem that you need to start addressing as soon as possible. And for those of you maybe that didn't watch Tuesday's show on muscles versus medicine, we did a whole deep dive on the science of how muscle actually behaves like hormones. The chemicals that your muscles produce have hormonal effects on all of your organs. So they have tremendous amount of regulatory effect on your overall health. And so I basically in this show, I laid out that muscle is actually building lean muscle. You don't have to become a bodybuilder, but building lean muscle is more effective in a combination of 8 medications that are commonly used to treat some of the main diseases in our country. And so this is why exercise is just such a powerful entity that you should all be entertaining. You have one body, you should take care of it physically. We talk a lot on the show about taking care of the body chemically, right? What you put in, the nutrients, the chemicals in food, and avoiding those things. Those are chemical reactions, but the physical component is just as important as the chemical component. And in my experience, most people ignore the physical component more than they should. Most people know they need to exercise. There's a concept in their mind that they're like, I know I need to, but time, life got in the way, or I know I need to, but I'm injured or I hurt. And when I try to exercise, it hurts more. So watch that show if that's you. If that resonates with you, go back and watch Tuesday's show, because I do a deep dive and I even give examples of easy ways to implement exercise with time and easy ways to implement it in terms of scaling movements so that you're not going into it and injuring yourself. I did try SPM for gum inflammation at 2 teeth, no pain. Can always tell it is not right. With SPM, I'm not constantly aware of the situation. So I think that was Janet was here a while back, and we were talking about SPMs, supplemental SPMs as are specialized pro-resolving mediators that deal with inflammation. And I asked her to come back and let us know how it worked out for her. And it looks like there's some improvement. So Janet, thanks for coming back in and sharing that with us. How to help perimenopause symptoms. Get a hormone panel done, because there's different reasons why women can develop the perimenopausal symptoms. But you've got to change your diet. If you haven't already changed your diet, you got to get your carbohydrates down to around 33% or less of your total calories, because a lot of perimenopause is actually carbohydrate toxicity. You got to make sure you're gluten-free, grain-free. A lot of what we see, I did a show on this a while back on women's hormones. We maybe put up a link to that show for Hildebrand. But one of the things we know about gluten is it's an endocrine disruptor, and endocrine disruptors mean it affects your body's ability to make hormones appropriately. And so one of the side effects of gluten is perimenopause. It's pseudomenopause. I've actually had women that thought they were in menopause for years, and when we change their diet, they get their cycle back. So we know that the diet can dramatically affect how people can produce hormones, and perimenopause symptoms are sometimes a pseudomenopause that is caused by dietary inflammation, and that needs to be looked at. What would the proper steps be to heal a leaky gut and a yeast overgrowth? Good question, Johnny. I've got articles on both of those. Go to glutenfreesociety.org. There's an article called 10 Steps to Heal Leaky Gut. And as far as a yeast overgrowth, I have an entire crash course on that. It's a big question. The biggest thing is to not do things that drive leaky gut. So the biggest thing that drives leaky gut is eating bad food and eating chemicals. So if you can eat real food and cut out grain, that's step one. As a generalized rule of thumb, that's going to take you a long way to overcoming leaky gut. As far as the yeast overgrowth is concerned, for most people, it's carbohydrate. Yeast feeds on carbohydrate. Yeast, their metabolisms are different. They actually ferment carbohydrates to make energy. So the more you feed them carbohydrates, the stronger they get. When the stronger they get, the worse off your health, deteriorates. So you've got to take out their fuel source. There's 4 ways we like to get rid of yeast. We flush them out, and the way we flush out yeast is we use vitamin C, and we use high doses of vitamin C, and we do what's called a vitamin C flush. I have the instructions for how to do one of those on my website, glutenfreesociety.org. If you just type in detox C flush in the search bar, you should find those instructions. So we flush them out, we poison them out. The natural things that we like to use to make it hard for yeast to thrive is, one is caprylic acid. Caprylic acid is it's a type of fatty acid that embeds in the cell membrane of yeast, and it puts little holes in the cell membrane, so it makes it hard for them to survive. And it's very safe to take. It's an over-the-counter, so there's no, like with some of the antifungal drugs, like the azole antifungals, those cause potentially liver problems. Caprylic acid does not. Very safe to take, even over long periods of time. So we flush them out, we poison them out, we create competition for yeast. The natural competition for yeast is probiotics, specifically Lactobacillus bifidobacter. So, finding a really solid probiotic, we have several varieties, but, the one I recommend people use for in this type of situation is a product called Biotic Defense with S. boulardii. The S. boulardii competes with yeast. The Lactobacillus and bifidobacter also compete with yeast, and all those things are in that particular probiotic. And then the 4th strategy is you have to starve them out. So that means you have to change your diet so that you're not feeding them. So we flush them out, we poison them out, we create competition for them, and we starve them out. That's how you deal with the yeast overgrowth in a nutshell. But I have entire videos on that you might want to go check out. So go to my YouTube channel and subscribe there, where I do crash courses, and just look up my crash course list on my YouTube channel. And there's hundreds of, very comprehensive classes on how to do these things that you're asking. How does caffeine affect muscles? When I consume a lot of coffee and tea, I get tired and feel pain in muscles. To mitigate it, I take vitamin B1 and magnesium, then I feel much better. You've discovered one of the reasons that caffeine causes muscle pain is that it depletes magnesium and it depletes vitamin B1. Caffeine is a stimulant of stress hormones. So if now there's benefits to caffeine. If you've ever heard of a dose response curve, meaning that something, if you take at a reasonable dose, there's a benefit. But if you go above that dose, there's a detriment. And caffeine is a lot like that. You could get away with 120, maybe even up to 200 milligrams of caffeine a day with relatively lower side effects, or not running the risk of the side effects. But when you get into that 2+ coffee cup, depending on the size of your cup, doses per day or higher, that's when you start seeing the negative detrimental effects of caffeine from the coffee on your nutritional status. And magnesium and vitamin B1 are depleted by too much caffeine, as are other B vitamins and other minerals. But magnesium and B1 work together to help your muscles relax, but at the same time metabolize energy and generate what they need. Whereas caffeine drives stress hormones, which can lock your muscle down into a fate where it's generating energy, but it's doing so inefficiently. And one of the byproducts is the buildup of a chemical called lactic acid that can lead to some aches and pains within the muscle itself. So you're on the right track there. But I would say if you're finding that to be your case, back off your caffeine. There's a limit to that stuff. And a lot of people have to discover that through symptoms. But you can enjoy a cup, but not everyone can, but maybe you can, but don't go beyond that. How to help itchy skin? Is there any cream to get rid of it? You got to figure out what's driving it. Most of the time, itchy skin is some type of reaction. It's a food reaction, it's an environmental or a chemical reaction. And so you have to determine what actually is driving it. Now, I've seen itchy skin be caused by people that don't have gallbladders, or that have got bile sludginess, so their bile acids are just not being produced properly. And so things like taurine and vitamin C might be helpful in that regard. But with itchy skin, there's generally some type of immune response that's driving a histamine production that's causing the itchiness in the first place. And you got to figure out what that is. You can apply things like aloe directly, and you can go buy an aloe plant, just break the leaves, and you can take the gel from the inside of it, and you can just apply it directly to the skin, and that can be sometimes very helpful. But it's a symptomatic reduction. It's not a long-term solution. So short-term improvement of quality of life, but you got to go after the underlying cause. Vitamin D3 at 80 to 100, no fruits, no vegetables, no breads, pasta, etc. Okay, I don't see a question there. My home has mold due to a bad roof, but it has not affected me so far. Well, get the roof fixed and get the mold out before it does. That would be my advice. Mold is the longer you're in it and the more of it that's there, generally the more it will break a person down over time. So get it taken care of as soon as you can. TPO testing is necessary to confirm, but I have no physical symptoms of Hashimoto's anymore. No question there. Looks like a comment. Started weight training in March and recently had some pain in my leg, which I know was coming from the sciatica. So if you were weight training, Janet, let's say you're doing some leg exercises and you maybe strained your piriformis or your gluteus muscle. The sciatic nerve runs right under those muscle groups, and that can be the case sometimes when people have a strain in those muscles. It can spasm that muscle and put compression on the sciatic nerve, and that's a physical problem. It can be treated with stretching in some cases, although sometimes stretching can exacerbate sciatica. So the right kinds of stretching, but also if you started training in March and this happened, sometimes people train improperly. So I don't know what your skill set or knowledge is around weight training, but you might also consider hiring somebody who can, for maybe a month or two, walk you through the right types of exercises with the mindset of injury prevention, so that you can build some core strength. And that way you just reduce your potential for injury going into the future. Those are just some suggestions. What does caffeine do to kidneys? I mean, it works them. It works them. It puts the kidney under more pressure. The kidneys have to filter more aggressively. Caffeine's a diuretic, so it pushes more fluid out through the kidneys, and what comes along with that is more pressure on the kidneys. So if you've got kidney problems and you're overloading your caffeine, it's a bad idea. Betty commented on somebody was asking about dark spots earlier, and so she just made a comment. I think it's a good one to call out. She said she did 6 months of phototherapy, which is ultraviolet therapy, and castor oil daily, and it improved quite a bit. That's fantastic. Thanks for sharing your experience there, Betty. Let's see here. What are good strategies for histamine sensitivity? If it's just like an environmental allergy that you have and your body is, releasing histamine in response to something that you can't control, really a couple of good things that you can do. We have a product called Histacyst, which has several ingredients in it that stabilize the mast cells. And by stabilizing the mast cells, you can control the release of histamine more effectively. Another strategy would be something called DAO, diamine oxidase, which is an enzyme that degrades histamine. And you can get that supplementally as well. We have a product called Ultra DAO for that. So those are both good strategies. Some people don't tolerate bromelain, some people don't tolerate nettle. They're allergic to those ingredients. And for those of you that are, consider adding vitamin C at like a 5-gram dose a day with quercetin, like a 2-gram dose a day. Because the combination of that can also sometimes be very helpful for people with histamine reactions. My mom, 90 and in good shape, walks daily, independent. The last 3 years, one hip dropped and she's leaning to that side while walking. In your experience, what could be the reason for this? Get her x-rayed. Sometimes in the upper 80s and 90s, we'll see compression fractures of the spine, and that'll shift the hip. And if that's happened to her, it'd be good to know that there's certain things that you can do. Really, there's not a treatment. You don't cast a compression fracture, but understanding that it's there, you can allow, if she works with a good chiro or physical therapist, that allows for the potential for some solid physical therapy that can improve with that. But I would start with an x-ray just to make sure there's not something like that happening. Let's see. What do you think about L-Reuteri for muscle growth? I would say I wouldn't say that I have any experience with that in the context of muscle growth. I wouldn't speculate that it would help or aid muscle growth one way or the other. Um, what helps muscle growth predominantly is resistance. It's just that simple. Put your muscles against gravitational force and pressure, and they will respond by getting larger and stronger. Beyond that, creatine as supplement, if we're talking about supplements that can be helpful, creatine, no doubt, probably the number one supplement a person could take, natural supplement to enhance muscle and strength. Outside of that, it's all about recovery. Branched chain amino acids, glutamine for the recovery, creatine for the increased strength and energy. So postmenopausal borderline A1C, getting muscle cramps and burning sensations, mainly in the legs, more in the right leg, take maglycinate, Bs, but still having issues, get it looked at. It sounds like a neuropathy if it's just one leg, and it could be usually when it's one leg. Well, maybe it's both legs, but more on the right leg, so maybe just less in the left leg, but that could be systemic. Neuropathies are oftentimes inflammation or inflammatory in nature, which that could be food induced, that could be microbial induced, it could be nutritional deficiency. You might look at alpha lipoic acid, you might look at higher doses of vitamin B1, B12, or folate. Those B vitamins tend to contribute to neuropathy more than others. But I would look at all of those as a potential for why that's happening. Is hormone therapy something my wife should consider? I saw your interview with Robin. Maybe I don't know whether or not your wife should consider. I don't know enough about her, and that's a big question. I think it's a big decision to make, because to me, I generally tend to err on the side of conservatism when it comes to any medicine, but I also understand there can be a benefit sometimes for medicine depending on the person and the nature of of their symptoms and their problem. I get low grade pain all over, headaches specifically in the morning. If you've got pain all over, you've got something driving inflammation, and that has to be investigated. What are the triggers? Food, chemicals, microbes, nutritional deficiencies. Um, so that, I would get with a good doctor that can work you through that. If you don't have one there, just call my office. We still take on new folks. We've got a new doctor working in our clinic now too. I've been training him for the past year, and he's doing great work for people. Let's see here. I like this another comment. My cat with renal disease is doing better on grain-free food. Yeah, your animals are the same as we humans. None of us really do well with grain as a staple food. And animal pet food is horrible. Shame on vets for allowing that to happen. Not all, but many of them. They sell these special diet foods that are just full of junk. Curious if doing a mucoid plaque cleanse of the gut is safe with leaky gut. Well, what's the cleanse entail? I mean, that's really the bigger question. What are you doing for a cleanse? Diagnosed with granuloma annulare. Do you think there's any relation to it in hypothyroidism? Well, the relationship that I would draw would be that gluten can contribute to both. And if you haven't entertained gluten-free, grain-free, then you should be on that path. Can too much cod liver oil cause a histamine reaction? Generally, I mean, too much cod liver oil, the biggest risk with too much cod liver oil really is a vitamin A overdose, which is not typically something that we see cause a histamine reaction. But some people, have histamine reactions to foods because they're allergic to the food. And fish allergy is not uncommon. So you might be taking more, and as you take more, your body has a reaction to, like a low-grade allergic reaction to it, that's showing up more as you get the dose up higher. Okay, so herbal cleanse. Tyler's asking about a mucoid plaque. Is it safe to do an herbal cleanse? So if you have a leaky gut, as a general rule of thumb, you're not going to hurt yourself with an herbal cleanse unless the herbs you're using have some other kind of potential side effect. Without you listing the actual herbs that you're using, it's a little harder for me to make that determination and give you guidance specifically about herbs. But my favorite way, Tyler, to do a cleanse is not an herbal cleanse. My favorite way, the simplest way, and probably one of the safest ways to do a gut cleanse, is high doses of vitamin C. Vitamin C is very safe. You can't be allergic to it. It acts as an osmotic, so it pulls water into your bowel and cleanses and pushes the mucus and the buildup of the GI tract and obviously and the stool, pushes it all out. So it cleanses really, really well. We actually, for a lot of people that don't want to do the generic prep for colonoscopies, we have them do a vitamin C flush for their colonoscopy prep, and we've never had a problem. There's never been a person whose GI doctor came back and said, you didn't prep right, because vitamin C cleans you out, and if you take it, at the right doses for long enough. But anyway, that's just my 2 cents. Let's see. Would you explain 5-MTHF? It's a big question. Methyl tetrahydrofolate. 5-methyl tetrahydrofolate is it's a form of folate that is methylated that drives the production of several neurotransmitters, predominantly those serotonin. So it's in the pathway to the body's ability to produce serotonin, but it's also at a key critical role in the methylation cycle, which is a biochemical cycle inside the body that helps to produce biomolecules that aid in the production of DNA, RNA, protein, that aid in the production of glutathione and cysteine. So it plays a central role. Think of it as a master key for the methylation process that aids the body in detoxification, but also aids the body in neurotransmitter production, as well as healing and growth. I don't know if that helps you. Now, if you want to learn more about folate specifically, I have an entire crash course on folate. Now, if you're talking about the gene methyl tetrahydrofolate reductase, MTHFR, that's a different, it's the same thing, there's a whole kind of, that's an enzyme that helps to methylate folate. So I don't know if that helps you understand it very well, but I think I answered the majority of your question. And check out our crash course on folate to do a deeper dive. We go into folate for a good hour, and all of its, if you like visuals, it's hard for me to give you visuals in this kind of setting. So vitamin C flush, do we have a link for that we can post? So a couple of questions that have come in about the vitamin C flush. Basically, Tyler, it's 2 teaspoons, which is 6 grams. So 6 grams of vitamin C mixed in 3 ounces of water every 15 minutes until you flush. The flush is diarrhea. So once the diarrhea starts, it'll take a couple hours to clean you out, but then you're done. So that's the general rule of it. So, but we do have some instruction sheets on our website at glutenfreesociety.org on how to do a vitamin C flush. I don't know if we can share those links in our TikTok feed or not, but if you want to go over to Gluten Free Society, you can type that in the search. So going back to the question about the 90-year-old with the drop in the hip, yeah, X-ray her lumbar spine and also X-ray her hips. So be 1, 2, 3, 4, 5, about 6 views, maybe 8, depending on what the doctor wants to look at. But you'd want to do like an AP and lateral lumbar view. You could do an oblique in the lumbars as well. So that would be 3, and then you would do each hip 4 and 5, but you would do them in multiple positions. So you do the hip kind of in a regular standing position, and then you do what's called an APOM. No, I'm sorry, not an APOM, a frog leg view frontally of the hips to determine if there's any type of bone loss or any other type of abnormality, osseous abnormality. When I sit with my legs propped up in front of me, my shins feel like the tissues on the side of my shin bones are being ripped off. You've got tight anterior tibialis muscles, most likely. Sabrina, if you sit on a couch and one leg hanging over the side of the couch, the other leg propped up on the couch in front of you. What you want to do, that leg being straight out in front of you, is, so imagine this is the leg. Now you're going to invert. So this is your foot and this is your leg. So you're going to invert the foot this way, inward, like that. And then you're going to lean forward, grabbing your ankle. And what you're going to feel in the lateral aspect of that leg is you're going to feel a stretch in that shin, that anterior tibialis muscle. And do that and see how hard it is. See how much that hurts. What a lot of people with your symptoms experience is tightness of that muscle creates that symptomatic problem, and stretching that muscle out can really, really help. You might also have a compression of the nerve that runs through that muscle. And if that muscle is tight, it can compress that nerve so that when you bend the leg towards you, it irritates that nerve and creates that type of pain that you're experiencing. So generally some good stretching, try that first. And if that doesn't work, go get it looked at, because there are other techniques and other things that can be done for it. But that typically is a anterior tib issue. It's common in runners who have poor gaits when they run. I don't know if you run or not, but just more context. Does the type of vitamin C matter? Oh, yeah, good question. Well, I'm partial. We have our own vitamin C in our store. You can buy Detox C in the powder form. Yes, you want powdered vitamin C. The key with vitamin C is that, what most people don't realize is by the time you buy supplemental vitamin C, it's oxidized. So it's really not doing much. Vitamin C has to be very, very specifically and meticulously produced. And one of the ways we make vitamin C, one of the things that we do to preserve it is we produce it under what's called a nitrogen blanket, which is a gas blanket that protects the vitamin C from oxidizing. That way, when you package it, you're not just packaging up a bunch of oxidized vitamin C that doesn't have any therapeutic benefit. So that part is very, very important. Most manufacturers don't go through the expense of doing that. We do, because we want the quality, we want the outcomes. The other big issue with a lot of vitamin C is the vast majority of them are produced from corn derivative, GMO corn derivative. They just don't say it on the bottle. So we don't, our credo is no grain, no pain. We don't want the grain-based products in our products. So we take the care to not make our vitamin C from GMO corn. So those are two big issues. You also want a powder, because if you're doing a flush, you don't want to have to break these pills down. It takes longer for the GI tract to break down the lacquer or to break down the capsule around the pills. And so you want that pure powder because you want it to work right away. So good question. let's see here. Morning headaches, pain all over my head. They usually disappear midday. Um, you might, there's several things that can be kind of triggering in that regard. One, it could just be the way you're sleeping and how your head is on the pillow. And then you wake up in the morning after 8 hours of neck position being out, that can create headaches and that can create neck pain. So I would look at posture for sleep. The other I might consider would be how often you change out your pillow or wash your pillowcase. We've seen cases quite frequently of people having not done that, where their pillow's colonized with some type of microbe, and every night and they go to sleep, they're just being bombarded by that microbe, either from the pillow itself, because when we sleep, we drool. And then from there, it just, if it's a microbe and you're averse to it, you can have an inflammatory response to it, and that can create headaches and pain that will dissipate the longer away from that pillow you are. So I would look at those two things as a potential starting place. Okay. Well, that's it. I think we're 20 minutes over. Look, thank you so much for tuning in and watching the show today. We hope you learned something new, and we also hope that you help us in our mission. We are on a mission to save 100 million lives, and we can't do that without you sharing this information widely to help others, to help us help others and bring this message to more people. So please do that. Please take the time to hit like. Please take the time to hit subscribe. And if you find this information helpful, please take the time to send it to a friend or a family member, somebody you care about. Additionally, if you want to support us, we have at glutenfreesociety.org, we have a full shop with over 100 supplements that are gluten and grain free and pharmaceutical grade, very high potency. So if you're in the market for supplements and you're looking for high quality products without compromise, come visit our store and check out our products. We don't allow advertisers or sponsors. And so your support always helps us pay the bills and keep the lights on at the Dr. Osborne Zone. Additionally, don't forget, we also offer lab testing. If you're looking to see whether or not going gluten-free is the right move, we offer genetic testing. And we also offer testing for vitamin and mineral deficiencies direct to you. So you can check those things out again at glutenfreesociety.org. Beyond that, make sure you're signed up for our newsletter. It's the only way we can prevent true censorship from happening, which happens quite a bit in our realm. So if you want to prevent censorship, go sign up for our newsletter so that we can communicate with you directly as well. Thanks so much for tuning in. We'll be back next Tuesday, 6 p.m. Central Standard Time for a crash course. And again, next Thursday at 12:30 for a live Q&A to answer your toughest nutritional questions. Thanks so much for tuning in. We'll see you next week.